Hello everyone, welcome back to the channel. Today we're talking about a treatment so common that we sometimes forget how powerful and dangerous it can be. Yes, oxygen therapy. Oxygen is not just air. Since 1998, it has been officially considered a drug. And like any drug, it has indications, targets, and side effects. So let's start with the basics. Oxygen therapy is indicated in cases of tissue hypoxia, usually linked to hypoxemia, defined as a partial pressure of oxygen in arterial blood below 60 mmHg. But hypoxia is not always hypoxemic. There are two main mechanisms. First, non-hypoxemic hypoxia, such as in anemia or low cardiac output, where oxygen delivery is impaired despite normal oxygen levels. Second, hypoxemic hypoxia, which includes shunt, ventilation perfusion mismatch, and diffusion disorders. And here's a key clinical pearl. A true shunt does not correct with oxygen, while VQ mismatch and diffusion defects often do. Now let's talk about indications and oxygen targets. In most acute situations such as asthma exacerbation, pneumonia, pulmonary embolism, or shock, we aim for an oxygen saturation between 94 and 98%. However, in patients at risk of hypercapnia, especially those with COPD, the target is lower, 88 to 92%. More oxygen is not always better. In fact, unnecessary oxygen can be harmful, which brings us to hyperoxia. Excess oxygen leads to the production of reactive oxygen species. These free radicals damage alveolar cells, cause inflammation, alter surfactant, and may result in atelectasis due to nitrogen washout. Hyperoxia can also worsen hypercapnia through several mechanisms: loss of hypoxic respiratory drive, alteration of ventilation perfusion balance, and the Haldane effect. On the cardiovascular side, oxygen causes vasoconstriction by reducing nitric oxide, which can impair microcirculation. But oxygen also has benefits when used correctly. High-flow oxygen reduces the half-life of carboxyhemoglobin in carbon monoxide poisoning. It accelerates the resolution of spontaneous pneumothorax by increasing nitrogen gradients. And it improves tissue oxygenation in critical illness. Now, how do we administer oxygen? Low-flow systems include nasal cannula, delivering less than 40% FiO2. Simple face masks provide 35 to 55%. Venturi masks allow precise oxygen delivery from 24 to 60%. For severe hypoxemia, we use reservoir masks or high-flow nasal oxygen, which can deliver up to 70 liters per minute with 100% FiO2, heated and humidified. High-flow oxygen improves comfort, washes out anatomical dead space, reduces work of breathing, and provides a low level of positive airway pressure. Finally, remember this: oxygen is life-saving, but only when prescribed correctly. Always define your indication, always set a target saturation, and always reassess, because in medicine, precision saves lives. Thank you for watching. If you found this video useful, like, subscribe, and see you in the next one.